As a psychiatrist yourself, can you do a deep analysis of this other famous psychiatrist, which is the movie character played by Robin Williams at Good Will Hunting? Is it just a caricature between a psychiatrist and patient relationship, or is there something to you that was moving about his ability to connect to this obviously struggling young kid?
I think you've hit on the key thing there, which is the depth of the connection. If there's too powerful a connection, that can impair therapy, because it could impair open communication. If a patient sees the relationship in a particular way, like in a friendly way, maybe, or like a parental child type way, that can cause problems, because then what they choose to share, what they choose to bring up, is selected to be appropriate for that view of the relationship. And so I and many other talk therapists actually prefer not to let things get, not let the connection get that deep. You want to have trust. You want to have a therapeutic alliance, we sometimes call it. But it's got to be enough of a blank slate that the patient is not consciously or unconsciously constrained in what they choose to share. And so, great movie, great actors, all good, no complaints, except realistically, the relationship should be a little more arm's length than that.
But let's pretend this is real life. Sometimes, can't you leave a little bit of yourself in the interaction with the patient?
Yeah.
I mean, it's another human being.
Yes. So it's a balance. And actually, you do need some of it, because let's say this person is having challenges, interpersonal challenges in their life. The best way to notice what those are and to identify them and to work with them is if you can elicit some of those problems in the office, in the therapeutic interaction. And this is really powerful. As long as you're alert to it, aware of it, and you don't let it go out of hand, this transference, we call it, is when you transfer in between the current therapeutic relationship and external relationships that the patient may have had with others. And so if the therapist starts to feel an inner feeling like anger, let's say, so let's say you have a patient who is stirring frustration in you, or even in extreme cases, anger, the best thing for the therapist to do in that case is to recognize it and to realize that's probably being stirred by other people in the patient's life, and that could be the source of a lot of problems. And so instead of trying to wall it off and say, oh, I shouldn't be feeling that, I better be a better therapist, instead recognize it and use it and help the patient that way. And so you've got to be a human being. You've got to be a person who feels. You've got to be open.
But be in control of it and be aware of it. If I may, I just want to read because it's my favorite scenes. Probably one of the greatest scenes in movie history, because Robin Williams does a single take.
Is that right? I didn't know.
So this is a very interesting interaction between them. So Will, and I'm sure this is a common interaction, maybe with a therapist and a patient, maybe with a father and son, where Will, the young character, the young brilliant mathematician, and Sean is the therapist, the older therapist, where Will looks at a painting that Sean painted and then does a deep critical analysis of the painting that basically, describes pretending as if he can understand another human being completely, but just looking at their painting. And then Sean gives this whole speech that contrasts sort of raw intelligence and the wisdom of experience. And Sean says, single take. He says, you've never been out of Boston, right? And Will says, nope. All this in a sexy Boston accent, by the way. And then Sean gives this speech. If I asked you about art, you'd probably give me this skinny and about every art book ever written. Michelangelo, you know a lot about him. life's work, political aspirations, him and the Pope, sexual orientation, the whole works, right? But I bet you can't tell me what it smells like in the Sistine Chapel. You've never actually stood there and looked up at that beautiful ceiling, seen that. If I asked you about women, you'll probably give me a syllabus of your personal favorites. You may have even been laid a few times. The language here is just beautiful. But you can't tell me what it feels like to wake up next to a woman and feel truly happy. You're a tough kid. If I asked you about war, you'd probably throw Shakespeare at me, right? Probably not, but let's say. Once more into the breach, dear friends. But you've never been near one. You've never held your best friend's head on your lap and watched him gasp his last breath, looking to you for help. If I asked you about love, you'd probably quote me a sonnet. But you've never looked at a woman and be truly vulnerable, known someone who can level you with their eyes, feeling like God put an angel on earth just for you, who could rescue you from the depths of hell, and you wouldn't know what it's like to be her angel. To have that love for her, be there forever, through anything, through cancer. And you wouldn't know about sleeping, sitting up in a hospital room for 2 months, holding her hand because the doctors could see in your eyes that the terms visiting hours don't apply to you. You don't know about real loss, because that only occurs when you love something more than you love yourself. I doubt you've ever dared to love anybody that much. I look at you. I don't see an intelligent, confident man. I see a cocky, scared, shitless kid. But you're a genius, Will. No one denies that. No one can possibly understand the depths of you. But you presume to know everything about me because you saw a painting of mine. You ripped my fucking life apart. You're an orphan, right? Do you think I know the first thing about how hard your life has been, how you feel, who you are because I read Oliver Twist? Does that encapsulate you? Personally, I don't give a shit about all that because you know what? I can't learn anything from you that I can't read in some fucking book unless you want to talk about you, who you are. And I'm fascinated. I'm in. But you don't want to do that, do you, sport? You're terrified of what you might say. Your move, Chief. Well done, sir. I know it's a movie. It's interesting, right? So some of that conversation is at some intellectual level, too. It's not just emotional. It's something, it's like, the reason I kind of connect with that is that's a lot of work for a therapist. Like to really understand another, because I mean, okay, I know this is fictional, but just there's calculation happening. He deeply cares to say the words that the other person needs to hear, but also a little bit loses himself in the pride, but then catches himself again, switches from anger to connection.
Yeah. A lot is brought up there. You're right. There has to be some emotion in the therapist to care enough to keep going, to keep probing, to open up as he's doing so. Right. He revealed a lot about himself, his own vulnerabilities, but that gave him authenticity. He had to open himself up so that the kid would see the authenticity and open himself up in return. So how do you do that as a psychiatrist, as a therapist? You have to be careful. You know, you don't want to do too much, but opening up a little bit does help. It does create a chance. You know, you're offering up something, and that helps the patient come back in return, and it gives you that believability and authenticity.
Do you pay the price for that, for opening it up?
You can.
You have a family. You have an incredibly difficult research. Like you're doing a lot of things in your world. I mean, it's a price you pay for
Yeah. Well, this is one of the terrifying things about writing the book was I do open up in a little bit about my own personal life, my own personal challenges, and that was a considered decision because I could have done the patient work and the science work and the history of the human family work and tied it all together, but it wasn't. and I in an early draft it was like that, but it wasn't real yet. It wasn't something that everybody could connect with. And I said, then I realized, look, if I'm going to do this, I've got to open up myself, and then people can connect with me and see what I'm really saying. And so I did, and it was not something that I'd gone in planning to do. In retrospect, I learned a lot about myself. It was actually really, I think, a good thing that I did, but it was scary.
Where are the darkest places you've ever gone in your life?
I had things haven't always been easy personally or professionally. I had moments. I was effectively a single dad for a while, a number of years, and these came at probably the hardest also professional lifetimes for me too. The absolute hardest days of late medical school, internship, taking call, getting up at 3 a.m., surgery, medicine, rounds, unforgiving environments, and then all the while, personal life, stripped down to the bare. And these were low moments. And then I was hit particularly hard by just experiences on the clinical ward, connecting to deeply with patients, like a child with a brain tumor, and feeling it too strongly, and those things. When you get down to those lowest of the low moments, when everything is stripped away, and there's only this raw core. Well, yeah, that's pretty hard. That was probably the lowest moment, and you learn a lot about yourself in those moments. What's left, and then what are the roots out from there, and that can be powerful to see in yourself.